Hi, this is Dr. Khaled Bawarshi. I'm a psychiatrist in Wesley Chapel in Tampa, Florida. I specialize in treatment-resistant depression. I treat depression using TMS and esketamine, as well as some medications sometimes. A common question that I get is, when do I expect to see some improvement in my depression if I start TMS? So, as you know, TMS is done daily, 5 days a week, Monday to Friday, for 6 weeks, and then after that, taper off of 6 sessions over 3 weeks. So, but when you start TMS, you want to know, okay, when do I know whether it's working for me or it's not working? The answer to this question is that patients who go through TMS, compared to the ones who go through sham in clinical trials, meaning that goes through placebo, a machine that makes a noise but doesn't really deliver TMS, they separated by the second week of treatment, meaning that the effectiveness of the treatment can be detected by the second week of treatment, meaning after 10 sessions. And most patients who responded to TMS, they showed the response by the 20th session or the 4th week of treatment. Okay? All right. So technically, the translation of this is that if you start seeing improvement by the second week, then good. And if you don't see improvement by the 4th week, the chances of you responding to TMS diminishes after that. Let's go to the screen and see some of the evidence in there. This is the pivotal trial that was published in 2007. You can see those are 3 rating scales looking at the collection of the patients generally, and the ones that are in gray are the sham, meaning that they're placebo. You know, they have a machine that makes a noise similar to TMS, but it doesn't really deliver TMS treatment. And the ones that are in black, dark color is technically the ones who actually receive TMS. This is active TMS. Notice how the significant separation happened in week 2. By week 4, most of the improvement or the separation between active and placebo, you know, was already proven. And by week 6, we did not gain that much when it comes to patients who continued for the next couple of weeks. We still continue for 30 treatment sessions. There is some evidence of that helping prolong the durability of the treatment over time. There is some cumulative effect of continuing treatment beyond 20 sessions. But what I want you to know in here is that if a patient is not responding by the 20th session and they tell me, you know what, doc, I want to stop now, I don't think I'm responding, I'm not going to object to that much, right? I would still tell them that there is still a chance, but it's a smaller chance. But if somebody tells me here by the second week that, hey, doc, I'm not responding, I'm like, hold on. You know, you might still have the response because most of the responders were responding by the 4th week. Similar thing with another rating scale, and this is the graph for the other translation of that, of how, like, you know, most of the responders, you know, already by the 4th week, they showed the response. Okay, all right, so hopefully this answer is useful for you. Quick disclaimer before I leave you. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the uniqueness of your case. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. And if you have any questions that you would like me to answer, you can either submit them through our websites or leave them in the comments. I'm gonna try to make some videos every couple of weeks answering questions that are related to treatment-resistant depression or TMS. Thank you.